We all know about how the transition from standard time to daylight saving time in the spring affects us physically and economically. But what about individuals' mental health? Let's find out.
Let's begin now.
Have you ever felt drained, not as happy, or found that life is more difficult from around October through January? If you have, then you may have experienced the winter blues or SAD, known as seasonal affective disorder. So what's the difference between SAD and the winter blues? So the winter blues is akin to more of mild depression, where the individual does feel depressed or down, but they're able to carry on with the daily activities that they're used to. Whereas SAD is more of a full-blown depression or major depression, where the individual has a hard time, for example, getting out of bed, or they can become suicidal and even in some cases commit suicide. While SAD can affect individuals during the summer, most individuals who experience this disorder do experience it during the winter, and so this mental health issue specifically affects individuals in the northern hemisphere in countries like Canada, Denmark, Sweden, Finland, Russia, and parts of the United States. To put it in simple terms, the further away someone lives from the equator, the less sunlight they will be exposed to during the winter months, resulting in a vitamin D deficiency. The opposite is also true in the summer, where the further away someone lives from the equator, the more sunlight they are exposed to during the day. For example, in Cochrane, Ontario, this is the town that is the furthest north that you can drive to in Ontario before the highway starts heading west. There's 8 hours and 12 minutes between the start of sunrise and the start of sunset during the winter months. Whereas during the summer, they get 16 hours and 13 minutes between sunrise and sunset. And of course, both of these times are the winter solstice, which is the shortest day in the year, compared to the summer solstice, which is the longest day in the year. If you take a look at Suva, Fiji, which is very close to the equator, during the winter they get 11 hours and 2 minutes between the start of sunrise and the start of sunset, compared to 13 hours and 13 minutes between sunrise and sunset during the summer months. Approximately 2 to 3% of all Canadians experience SAD, whereas an additional 15% of Canadians suffer from the winter blues. A total of approximately 10% of all depression cases in Canada are as a result of SAD. So at this point, you're probably thinking, so what? What does this have to do with the biannual time change? Psychologists and other professionals have only recently started studying the impact that the biannual time change has on individuals' mental health. Just last year, a study was published that showed that there was always an average of 11% increase in hospital contact with unipolar depressive episodes in the 10 weeks following the autumn time change. Other research that links the fall time change and depression shows a spike in suicides in data taken from Australia from 1971 to 2001. Researchers theorize that the spike has to do with how light affects the way daylight saving time manipulates our hours of light and dark. Moving the hour of daylight from afternoon to early morning, a time when most people are indoors anyways, whereas when people have some spare time in the afternoon or evening, it is already dark. The observed association is primarily related to the psychological distress associated with the sudden advancement of sunset from 6 p.m. to 5 p.m., which marks the coming of winter and a long period of short days. This has a negative psychological impact on individuals prone to depression and pushes them over the threshold to develop a depressive manifestation. Furthermore, individuals having previously developed depression in the winter as part of seasonal affective disorder may perceive the transition from summertime to standard time as an omen of a new depression to come, which could have a depressogenic effect in itself. If you look at when the sun set, the day prior to daylight saving time on November 4, 2017 in Ottawa, it set at 6:04 p.m. compared to 5:04 p.m. the following day after daylight saving time took effect. Between the summer solstice and winter solstice, there is a loss of 6 hours and 31 minutes of daylight in Toronto. If Ontario were to choose to adopt Central Standard Time year-round, then the loss of daylight would be 1 hour less, and we could avoid a spike in major depressive episodes during the fall time change. While this is not a cure for SAD or the winter blues, it would ultimately save some money in healthcare, as the spike would no longer happen and individuals can gradually get used to having less daylight, thus making the adjustment to longer nights less harsh. It isn't just the fall time change that wreaks havoc on mental health. The spring time change also has its own complications with respect to mental health. The loss of sleep from the spring time change puts our bodies into a jet lag. It takes a minimum of 3 weeks for us to get used to the time change, though research suggests that our bodies do not necessarily get used to the spring transition because our bodies are made for the natural shifts in daylight instead of daylight saving time. Many physiological processes show circadian rhythm of activity. Sleeping and waking are the most obvious circadian rhythm in mammals. There is considerable evidence that circadian and sleep disturbances are important in the pathophysiology of mood disorders, depression, and anxiety. Depressed individuals often show altered circadian rhythms, sleep disturbances, and mood disorders. Individuals that are night owls and those that suffer from insomnia are the ones that are most likely to suffer from the spring time change because they are the ones whose natural circadian rhythm is already disturbed, and the change in time causes a further disturbance that can be difficult for them to recover from. Those that work shift work and those who experience prolonged sleep disturbances are most likely to experience a cognitive decline, including anxiety and Alzheimer's, because of a lack of sleep. With the increasing data showing ill effects of the biannual time change, individuals, politicians, and professionals alike are taking a serious look at eliminating the practice. In fact, Finland was able to get the EU to start looking to eliminating the biannual time change by presenting a petition with 70,000 signatures because of the research that has been coming out showing how disturbed circadian rhythm affects individuals. As more research and understanding of mental health increases, more research will be done to explore the link between the biannual time change on individual mental health. As time goes on, there's more evidence linking poor mental health to both the spring and fall time change. Even though we cannot see mental health problems, we should not underestimate its impact on individuals and how it affects society as a whole. If you would like to learn more about how the biannual time change affects your physical health, check out our video, Physical Effects of Daylight Saving Time. If you would like to learn more about how it affects the economy, then check out our video, Economic Implications of Daylight Saving Time. If you agree that we need to put an end to the biannual time change in Ontario, be sure to sign and share our petition. The link is in the description. Let's make this the last spring that we spring forward. And lastly, don't forget to subscribe so you can be the first to know about any new videos.